This is the third part of our chlamydia, mycoplasma, and ureaplasma lecture. And we are going to focus on the family of organisms Mycoplasmataceae, which include two genera, Mycoplasma and Ureaplasma. So, oops, wrong direction. Okay, growth requirements for the Mycoplasmataceae family. These are highly fastidious organisms. They require very enriched media that contains peptones, yeast extract, and cholesterol. They are slow growing, not as slow as Mycobacterium, but they still are slower than a lot of the other organisms. They produce teeny tiny colonies after several days of incubation, and the center of the colony grows into the agar. They kind of look like little fried eggs, inverted fried eggs, when they're grown on specialized agar media. Most are facultative organisms, can grow pretty much in any condition, although Mycoplasma pneumoniae is an aerobe. We're going to talk about Mycoplasma pneumoniae. It has a variety of virulence factors. It's not all that well understood. It does have a surface adhesion called protein P1. It can attach to respiratory epithelial cells. It can attach to red blood cells, but the virulence factors aren't completely known for this organism. It causes a variety of complications such as pharyngitis, tracheobronchitis, ear infections or otitis media, pneumonia, and it can also lead to arthritis or joint infection and pain. And Mycoplasma pneumoniae accounts for 20% of all pneumonias. It causes a less severe type of pneumonia than your typical bacterial pneumoniae like Klebsiella pneumoniae or Streptococcus pneumoniae, but it is a very common form of pneumonia, and it's also called atypical pneumonia or walking pneumonia. Very common type of pneumonia in children and young adults. So, any of you in the class have ever had walking pneumonia or atypical pneumonia, it might have been Mycoplasma pneumoniae infection. Now, the other common bacterial pneumonias, such as Klebsiella pneumoniae or Streptococcus pneumoniae. So keep in mind that species name pneumoniae is a very common species name for organisms that cause pneumonia. So think about the final exam. If there's a pneumonia question or two, there's a lot of organisms that cause pneumonia. There's a lot of organisms that have the species name pneumoniae. So you really need to be comfortable with differentiating all of them together. If there's a little case study and it's clearly pneumonia, how are you going to differentiate between Streptococcus pneumoniae, Klebsiella pneumoniae, Mycoplasma pneumoniae, and any of the other organisms that might cause pneumonia? Now, more clinical manifestations, usually the Mycoplasma pneumoniae infection is an insidious onset, fever, headache, feeling tired, non-productive cough, very, non-distinct symptoms. Now, the bacteria are going to interfere with ciliary action, which can lead to desquamation of the mucosa, inflammation, and an exudate in the upper respiratory tract. So, organisms are shed in the upper respiratory tract for 2 to 8 days before symptoms begin, which is dangerous because you're shedding the organism to other people around and you don't even know you have an infection. You have no symptoms. Now, the symptoms and shedding can continue for 14 weeks after infection. The habitat of Mycoplasma pneumoniae is the upper respiratory tract of humans. Disease is much more common in the summer months. It's more prominent in areas that have more temperate climates. That's why it's more common in the summer. More common in people between the ages of 5 and 15 years. It's very uncommon in small children, like little babies less than 6 months of age. Transmission is droplet aerosols. There's not really a good way to prevent it. People are shedding the organism, and so if you happen to be susceptible, you will get the infection and it might result in pneumonia, but it's not usually a severe case of pneumonia. It can be treated with erythromycin and tetracycline. We're going to now talk about another Mycoplasma species, and this is Mycoplasma hominis. The clinical manifestations of Mycoplasma hominis are post-abortal or postpartum fever. So this type of infection. The organism is commonly going to be isolated from the blood. This is usually self-limiting. Antibiotics could decrease the duration of the infection and decrease the fever. It can lead to pelvic inflammatory disease that's associated with infection of the fallopian tubes. So any type of genital infection, if it doesn't go away, if it's not treated, can result in pelvic inflammatory disease. The habitat is the genital tract of sexually active men and women. Rarely is it found in children. Transmission is endogenous. You can get infected with your own strains and more commonly through sexual contact. Prevention would be using condoms, and treatment is tetracycline. Another organism, this genus is Ureaplasma. It's very similar to Mycoplasma, but it's Ureaplasma urealyticum, and this causes a non-gonococcal, non-chlamydial urethritis in men, or chorioamnionitis and postpartum fever in women. The laboratory diagnosis of these organisms include staining and culture. So you can do direct staining of clinical material, although that's not very useful because these organisms do not stain well with gram stain. So you can use other staining methodologies, but it's not a common way for looking at Mycoplasmataceae family members. Usually this organism is going to be cultured. It's more commonly going to be done in a reference lab or a specialized laboratory because you need specific media. You need what's called Mycoplasma agar to grow these organisms. There are some strains that will grow on typical 5% sheep blood agar plates, and they grow as non-hemolytic pinpoint teeny tiny colonies. They just do not grow well on these media. So they do grow slowly. They usually take several days to even show little teeny tiny colonies. To see them, they usually require 1 week. Colonies remain very small. The center of the colony grows into the agar. We already mentioned it looks like an inverted fried egg. And you have to be able to differentiate Mycoplasma from Ureaplasma. And how you do that is Mycoplasma hominis demonstrates arginine breakdown, and Ureaplasma urealyticum is urease positive. And we've talked about urease a lot throughout the semester. So here is Mycoplasma hominis and Ureaplasma urealyticum. And so you can see the black arrow is Ureaplasma, teeny tiny organism. And here we have some mycoplasma showing that inverted fried egg appearance. Now here's an immunofluorescent stain showing the teeny tiny little mycoplasmas around inside cells. Now because these organisms are difficult to culture and they don't stain very well, more commonly they're going to be diagnosed through serology. So again, you get that fourfold rise in your serum complement fixing antibody during disease. You might have a single titer greater than 1 to 120, which would indicate a recent or concurrent infection. You can get demonstration of nonspecific anti-I antibodies, and these would be cold hemagglutinins where you have IgM antibodies that can react with the red blood cell I antigen, and it will agglutinate at low temperatures in the refrigerator. You can also get nonspecific anti-I antibodies, which are commonly seen in adenovirus infection, mononucleosis, which is another viral infection, as well as other illnesses. And that is the end of our chlamydia, mycoplasma, and ureaplasma lecture. So again, the key features of these organisms, the chlamydia, the fact that it's intracellular, the mycoplasma, the fact that it doesn't have a cell wall, that it's the tiniest group of organisms, how to differentiate mycoplasma and ureaplasma from one another, the diseases that they cause. Those are the important things to focus on when you're studying in this lecture.